Hello, I'm Dr. Douglas Bull. I'm an ophthalmologist here at Reedsburg Area Medical Center. Many people present to me with complaints of droopy eyelids or eyelids that are turned inward or outward. Those are treatments that we can treat here at Reedsburg Area Medical Center. People that have excess skin on their upper eyelids can have impairment of their peripheral vision, especially when they read, and we can perform a fairly simple surgery called an blepharoplasty to remove that excess skin, and that can help to improve your quality of life as far as being able to read or perform other activities throughout the day. People also can have problems with positioning of their eyelids, especially the lower eyelids. In many cases, the eyelid can turn inward, and that can cause severe issues as far as irritation, dryness, discomfort, because the eyelashes are rubbing up against the cornea. And that condition is called entropion, and that is a procedure that I perform here at Reedsburg Area Medical Center Department of Surgery. We can reverse that to reposition the eyelid in the correct position. Additionally, there's a condition that is the opposite of that, where there's an outward turn of the lower eyelid, which is called an ectropion, and that also we can reposition with specific types of surgery to help relieve those problems. And in that instance, people have problems many times with exposure of their cornea, which leads to dryness, and if severe enough, that can potentially lead to problems such as loss of the surface layer on the lower part of the cornea, and if that remains long enough, that can cause problems with potentially an infection such as a corneal ulcer. So those are things that need to be addressed most of the time and are relatively simple surgeries that take about a half an hour, and many times there never has to be any other additional procedures performed. So those are just some of the simple things that we can perform here. Additionally, if someone has the entropion, it can sometimes be caused by spasm of the muscles on the lower lid, and we can actually use Botox injections to relieve that spasm and help to resolve that turning inward. So that's a non-surgical option in some instances that is also available here. If you have any concerns with regard to any of these conditions, please contact my office and we are happy to evaluate.